We now come to Matt Hancock to make his statement. Secretary of State for Health, Matt Hancock.
Thank you very much, Mr. Speaker. And with permission, I'd like to make a statement on coronavirus. As winter draws in, this virus is on the offensive. 40 million coronavirus cases have now been recorded worldwide. Weekly deaths in Europe have increased by 33%, and here in the UK, deaths have tragically doubled in the last 12 days. The situation remains perilous. And while this disease is dangerous for all adults, especially with growing evidence of the debilitating consequences of long COVID, we know it is especially dangerous for older people. Cases continue to rise among the over 60s, who are the most likely to end up in hospital or worse. I'm very worried that the cases per 100,000 among the over 60s is 401 in the Liverpool City region, 241 in Lancashire, and in Greater Manchester has risen from over the past week from 171 to 283. This is why the government has been working so hard to act, and I'm very glad that we've been able to agree across party lines the necessary measures in Liverpool and in Lancashire, and we're working hard to reach such an agreement in Greater Manchester. We're doing everything in our power to suppress the virus, support the economy, support education and the NHS until a vaccine is available. That is the right strategy, charting a path that allows for the greatest economic and social freedom whilst protecting life. As the Director General of the World Health Organization said last week, and I quote, "Allowing a dangerous virus that we don't fully understand to run free is simply unethical." I agree. And I know that this is difficult, and I know that it's relentless, but we must have resolve and see this through and never stop striving to support the science that will one day make us safe. Mr. Speaker, I was at Chelsea and Westminster Hospital this morning, meeting NHS colleagues who are caring for patients with such dedication as they always do. And I heard from them how important it is for everyone to support the NHS by keeping the virus down, both so the NHS is not overwhelmed by COVID patients and so it can deliver all the essential non-COVID care that people need. I'm glad to report that the number of people experiencing a long wait for cancer treatment has been brought down by 63% since its peak in July. I want to thank all the cancer teams who are working so hard to ensure people get the cancer screening, diagnostics and treatment that they need, even in these difficult circumstances. But the best way to protect cancer treatment and all the other treatments in the NHS is to keep the prevalence of coronavirus down. And in doing this, of course, we're taking as localised and targeted a way possible. Our local COVID alert level system means that we can have different rules in places like Cornwall, where transmission is low, to Liverpool, where transmission is high and rising. On Thursday, I updated the House about several areas of the country that were moving into the high alert level, and today I'd like to inform the House at the earliest possible opportunity that Lancashire has now moved into the very high alert level. Infection rates in Lancashire are among the highest in the country and are continuing to rise rapidly, including in the over 60s, as I mentioned. Both the number of cases and the number of hospital admissions are doubling almost every fortnight, and the number of COVID patients in intensive care beds in Lancashire has already reached nearly half the number seen at the height of the pandemic earlier this year. So we knew we had to take rapid action to suppress the epidemic in Lancashire. We've always said that we'd stand side by side with any local area that agreed to move into this third tier and offer substantial support to local authorities, including for testing, tracing, enforcement and business support. I'd like to thank local leaders in Lancashire who've been working with us so constructively, and I'm sure that the willingness to put politics aside in the national interest and in the interests of the people who we serve will save lives and protect livelihoods at this difficult time. Mr. Speaker, following the successful introduction of measures in Liverpool and Lancashire, talks are continuing this afternoon, led by my right honourable friend, the Communities Secretary, with Greater Manchester. And this week, further discussions are planned with South Yorkshire, West Yorkshire, Nottinghamshire, the North East and Teesside. Sadly, over the weekend, we have seen very directly the direct impact of this disease. I was shocked to learn on Saturday of the sad death from coronavirus of Bill Anderson, the brother of Liverpool Mayor Joe Anderson. And my heart, and I'm sure the sympathies of the whole House, goes out to the whole Anderson family and the people of Liverpool who have lost a brother. And all of our thoughts go out to our colleague, the Honourable Member for Bolton South East, now in hospital with pneumonia after testing positive for Covid-19. We wish her a speedy recovery and send all our support to the NHS in Greater Manchester who are caring for her and so many others. Mr. Speaker, I'd also like to provide an update on testing, another vital line of defence. We're testing more people than any other country in Europe. We're now doing over 300,000 tests a day, up from 2,000 a day in February. And we've now opened over 500 test sites, including new walk-in centres in Dundee on Friday, in Edinburgh on Saturday, and in Newcastle this morning. Alongside this important work, we're working hard to discover and evaluate new testing technologies that are simpler and faster and cheaper. Some of these tests can produce a result as quickly as in 15 minutes, and we will make them available to local directors of public health as part of our strategy for local action, starting with areas in the very high alert level. We're rolling them out across hospitals and across care homes to test patients and residents yet more regularly to keep people safe, and for schools and universities so that we can keep education open safely through the winter. These tests have shown real promise, and we are both buying them now and ramping up our ability to produce them at scale right here in the UK. Mr. Speaker, we will stop at nothing to support this extraordinary scientific and logistical endeavour that can give us hope on the path back to normal life. And finally, Mr. Speaker, I'd like to inform the House that on Friday we laid regulations to support our rollout for both the flu and any COVID vaccination. While, of course, no vaccine technology is certain, we must be prepared to deploy a vaccine as soon as one is safely available. The new regulations both provide for a wider range of clinically qualified people to administer vaccines and provide for the MHRA to grant a UK licence for a vaccine before the end of the transition period, should that be necessary. Of course, we wish all of our scientists well in this vital work, and we will give them all the support they could possibly need. Mr. Speaker, we're once again at a decisive moment in our fight against coronavirus, and while our scientists work round the clock on the solutions that will finally bring this crisis to an end, we must all play our part and come together and work together to keep people safe, suppress the virus, and save both livelihoods and lives. And I commend this statement to the House.
Secretary of State for Health, Jonathan Ashworth.
Grateful, Mr. Speaker. And can I start by sending our condolences to Joe Anderson for the sad loss of his brother from this horrific virus, and also send our very best wishes to the Honourable Member for Bolton South East for a speedy recovery as well. As always, I thank the Secretary of State for advance sight of his statement. The virus continues to grow nationwide. The R is between 1.3 and 1.5. Increasing numbers of care homes across the country have seen outbreaks, with 214 in the last week. Admissions to critical care continue to rise nationwide. Yes, at a slower rate than in the first wave, but at this stage in the first wave, critical care admissions were starting to fall because of the lockdown. They currently continue to rise. On testing, on the saliva testing, the LAMP testing, we welcome the progress that is being made. It will allow us to introduce wider mass testing, a vital tool in taking on this virus. And I pay tribute to those universities developing great testing innovations, such as Southampton and my own, the University of Leicester, or the university of my constituency, I should say. But what is the timescale for the advances in testing that he is talking about? Is it still the plan for millions of tests a day? There was speculation back in September that his plan was for 10 million tests a day by February. So can he tell us what the daily testing capacity will be by the end of the year? Because we have seen delays in the pilots. Salford was supposed to be testing 250 people a day using saliva testing, but this has now been refocused. It's vital that testing of all frontline healthcare workers is now introduced to help the NHS get through the winter. So will he urgently speed up the validation of pooled PCR testing in the Lighthouse labs? It's not happening in the Lighthouse labs yet. We really need it. Now, Mr. Speaker, this virus spreads with speed, so testing must be quick. Yet results still aren't turned around in 24 hours. Again, when will they be turned around in 24 hours? And contacts must be traced quickly, and those who have traced be given support to isolate. Yet we have to be frank, a badly designed system failing to trace sufficient contacts, costing £12 billion and paying consultants £7,000 a day. Now, the Minister for the Cabinet Office justified the failings yesterday when on MAR, saying that the virus is accelerating, that when the virus is accelerating, quotes, any test and trace system of whatever kind has less utility. So after spending £12 billion, ministers now just shrug their shoulders and say, well, the virus is accelerating, so contact tracing is less useful. It's simply not good enough. The country is facing further restrictions because test and trace failed. So again, I urge him, fund local public health teams to do contact tracing everywhere and follow international best practice such as Japan. They focus on investigating clusters using retrospective contact tracing. We need this backward contact tracing everywhere, not just in the places which are hotspots. Now, this virus exploits clustering and social interaction, and I've always accepted that socialising in closed spaces, especially with poor ventilation, is a driver of transmission. But for interventions to be effective, both the consent of local people is needed and economic support is vital. Yet we are now in a situation where the Bishop of Manchester, a bishop for goodness sake, describes Liverpool as feeling cheated, Lancashire feeling bullied, and Manchester angrily determined. If he's seeking to impose greater restrictions on Greater Manchester, surely they need financial support so that people's livelihoods are not put at risk. So can he tell the Chancellor to spend less time admiring himself on Instagram and instead deliver a financial package to safeguard jobs across Greater Manchester? Now, the Prime Minister has promoted the Tier 3 restrictions because it means, in his words, there is a chance to bring the R down. But how do these restrictions in the north arrest growth in the virus across the rest of the country? The R across the south-east is 1.3 to 1.5. Across the south-west, it's 1.3 to 1.6. Across the east of England, it's 1.3 to 1.5. Cornwall, Devon, Suffolk, Somerset, Ipswich have recorded COVID rates in recent days per 100,000 higher than the average rates across Greater Manchester when they went into lockdown in the summer. So to get the national R below 1, more intervention will be needed than is currently proposed. So is it not in the national interest to now follow the advice of SAGE and adopt a 2 to 3 week circuit break? Last week, the Prime Minister, when asked about a circuit breaker, said, I rule nothing out. And he said he stands ready to apply those measures if necessary. But yesterday, the Minister for the Cabinet Officer ruled out a circuit break. So for clarity, has the government now completely ruled out a circuit breaker in all circumstances? Because the cost of delay could be a deeper, longer, fuller lockdown. Is he now ruling that out? But can I say to him, we do have a window of opportunity. Much of the country for much of the country, it's half-term next week. If it's politically easier for him, he doesn't have to call it a circuit break. He can call it a firewall. He can call it a national moment of reset. Whatever he calls it, we need something, because the longer the Prime Minister differs, the harder it becomes to take back control of this virus, protect the NHS and save lives. We urge him to act before it's too late.
Thank you very much, Mr. Speaker. And I'll absolutely address the questions that the honourable gentleman raises. The first set of questions about testing, I might have missed it, but I think he omitted to support and congratulate the work of everybody to getting over 300,000 tests a day delivered, on track to a capacity of over 500,000 tests a day by the end of this month. He asked about batch testing, rightly so, and that is currently being trialled. He asked to fund local contact tracing everywhere, and we have put those funds in to each local authority. But of course, we put the most support into the areas that need it most. And this approach that the government's taking of targeting the support and the measures on the areas where they're needed most is at the core of how you, as he put it, retain the consent of people whilst we go through these difficult actions. So I think that to be truthful to him, Mr. Speaker, he's far closer and more supportive of the government position than he feels able to express at this dispatch box, not least because he asked for economic support. And if I just leap to the Chancellor's aid here and defence, this government has put in unprecedented economic support to help people through these difficult times. The billions of pounds of aid and further aid forthcoming, and he asks in particular for economic support where an area goes into Tier 3, and that is exactly what I announced with respect to Lancashire, and of course that is part of the discussions that we have with local authorities when further actions are needed. So absolutely, Mr. Speaker, more economic support from this government, yes. More work with local authorities to deliver the local approach that's needed, yes. More testing capacity, yes. These are all the things that the government is delivering, and I behove the honourable gentleman to acknowledge and support them, since we are all clearly trying to deliver the same thing, which is to suppress the virus and save lives.
Chair of the Select Committee, Jeremy Hunt.
Thank you, Mr. Speaker. Can I congratulate the Health Secretary on the news about LAMP and lateral flow testing, which is potentially the most significant news this House has heard on the fight against the virus for many, many weeks. Given the dangers of conflicting public health messages when local leaders and national leaders say different things, is it not time to consider aligning incentives by saying that local leaders have the responsibility to bring down the R rate, to give them the powers and the resources to do that if necessary, but say if they fail to do that, they will be stripped of those powers in order to allow the government, to coin a phrase, to take back control?
The approach that we're taking, which is working effectively in almost every local area, is to work with local leaders, and we're doing this across party lines, whether it's in Liverpool or Lancashire, as I mentioned, or in South Yorkshire, in the North East, in Teesside, where the discussions are collaborative and consensual. And that is the way that we need to deliver the public health messages that are best delivered with everybody speaking with one voice, all working together to tackle the virus, not to mention London, where there has been a similar approach. In Greater Manchester, I would merely point out that over the past week, the rate of infection amongst those who are aged over 60, which is the group that is most likely to end up in hospital, has risen from 171 per 100,000 to 283. So it is absolutely vital from a public health perspective that we act.
Let's head up to Scotland with SNP spokesperson Dr Philippa Whitford. Dr Whitford.
Thank you very much, Mr. Speaker. The economic impact on areas under the tightest COVID restrictions is significant, particularly for the hospitality industry where many young workers are employed. COVID will be with us for some considerable time, so we need to learn to adapt and live with it as safely as possible. As I highlighted previously, COVID is spread by airborne particles as well as droplets, so ventilation is key to reducing the risk of spread. There are ventilation systems incorporating antimicrobial technology, which could reduce spread in indoor settings. So last week, I asked the Secretary of State if he would speak to the Chancellor about promoting their installation by removing VAT and making them tax deductible. He didn't answer, so I'll ask him again now. Does he recognise the importance of ventilation in the battle against COVID? And if so, will his government use their taxation powers to help make hospitality settings more COVID secure and avoid them being repeatedly shut down?
Thank you very much, Mr. Speaker. Absolutely will support hospitality businesses, and of all the sectors of the economy, my right honourable friend, the Chancellor, has supported the hospitality industry more than any other. And in fact, the UK government is supporting businesses right across the whole country. So when there is action by the Scottish Government to take action on public health grounds in a devolved way, it is the UK government that then comes in with the economic support. And this is yet another example of how much stronger we are all working together. I'll take away the detailed point and talk to the Treasury about it. It is, of course, a question for the Treasury rather than for me as Health Secretary. But I would just underline the importance of us all working together across Scotland, across the whole of the UK, and the economic firepower of the UK Exchequer being able to support people right across this land.
Brittle.
Speaker, in Hyndburn and Hassenden, we've got some of the strongest people I've ever met, and in fact across Lancashire, and we'll do everything to get our infection rate down, because that's what we do when times are tough. We come together. But morale is low, mental health is suffering as people can't see their family, and some have been unable to see their loved ones in care homes since March. Can the Secretary of State outline what the government is doing to mitigate this, and what steps are being taken to try and facilitate safe visits, given there's no clear end date?
Mr. Speaker, the Honourable Lady has shown real leadership in Hyndburn in very difficult times. This has not been easy for the people of Lancashire, and in Hyndburn there have been restrictions now for some time, and I appreciate how hard that is. But I think everybody will look to the way that my honourable friend has tried to support people as much as possible, has contacted me day and night with the cases of individual constituents, and has put herself at the service of her constituents. I think the people of Hyndburn are very well represented in her. On the specific point that she makes, absolutely we must ensure that just as places have to go into the level 3 of restrictions when we are concerned about the ability of the NHS to cope if things get further out of hand, so too we will absolutely reduce that restriction as soon as we safely can, and we'll do it not necessarily across a whole county, but on a district by district level if that is what the data say should be done. And that is something we're constantly looking at. For now, the single most important message to everybody in Hyndburn and across Lancashire is let's pull together, follow the rules and get this under control.
Let's head up to the North East with Ian Mearns. Ian Mearns.
Very grateful, Mr. Speaker, and can I thank the Secretary of State for the meeting that he had with North East MPs last Friday. And can I tell the Secretary of State that signs over the weekend are moving in the right direction if the data is accurate. Now, Mr. Speaker, I understand that SAGE has highlighted that the impact of any further potential restrictions will be felt very differently by different communities. SAGE suggests the need for immediate planning to refine measures to minimise potential harms and to mitigate the impacts on vulnerable groups. Given the government's commitment to the levelling up agenda, can I ask what are the government's plans to reduce the real risk that measures taken to respond to COVID continue to increase inequality and worsen levels of poverty and deprivation? Mr. Speaker, in the North East, we're not out of the woods by any stretch of the imagination, but can I urge the people of the North East to carry on doing the right things?
Mr. Speaker, the honourable gentleman speaks for everyone across the North East. The cross-party working has been first-rate, and I pay tribute to all colleagues from the North East who've been working so hard on this. The message to everybody in the North East is there are early signs that this is starting to work, but we are not there yet. So let's all stick with it, work together, support each other, support the NHS, and absolutely we will bring in the economic support to ensure both that we help businesses as much as possible, help employers and help individuals through this crisis. And then the levelling up agenda after that is something that is vital to unite the whole country.
Alan.
Thank you, Mr. Speaker. Can I say to my right honourable friend how correct he is that the most effective actions are those that are local and targeted. So when he looks at Tier 2 reviews. Could he confirm he'll look at those in light of Part 4, Para 8 of the regulations, so that we can target it on a local basis? And given so many cases are asymptomatic, could he say when he expects that new test to be more widely available across the community?
Yes, my right honourable friend makes an incredibly important point, which is that the regulations are written on a borough-by-borough basis, and if we can take specific boroughs out of the regulations sooner, based on the data, then we will, and we have done. And in fact, in some cases, we've taken part of a district or a borough out of regulations when that's what the data has shown, and I can give him that assurance. And on the testing, we're rolling out these tests as fast as we can. The use cases of ensuring that they can help to get more NHS staff tested on an asymptomatic basis, more testing in care homes where it's important to protect the most vulnerable, more support in education to make sure we can keep education as open as effectively possible, and asymptomatic testing in areas where there is a big outbreak. All of this will be there to support outbreak control and get this virus under control.
The Welsh Government has today announced a stringent two-week fire break in order to try and bring the R number down. Central to the strategy, of course, must be sufficient economic support to support businesses and livelihoods. Will he press the Chancellor to ensure that the Welsh Government has sufficient financial flexibility in order to pursue his chosen public health policy?
Yes, of course. The Welsh Government responds to the circumstances in Wales as it sees fit, according to the devolution settlement. As I was saying with respect to the SNP member earlier, we are absolutely prepared and ready and engaged in supporting communities, supporting businesses right across the UK, and supporting individuals who through no fault of their own, fall on what can be incredibly hard times because of the impact of coronavirus.
Thank you, Mr. Speaker. The Secretary of State knows that pubs, bingo halls and gyms have gone to enormous lengths to ensure that they offer a safe environment. And many of us in Greater Manchester and elsewhere are sceptical that closing those institutions would make a significant difference to the spread of the virus. But can I ask him why the government won't extend the additional resources for test and trace independently of those measures? Surely it would be beneficial to do so.
Well, across Greater Manchester and across Trafford, we have extended further support for test and trace before the tier system came in, and we've engaged to make sure that we get the benefits of the local teams being able to access, because they have boots on the ground, find people who the national team simply can't. And that will continue. Of course, the negotiations, the discussions around the future of what extra we need to do in Greater Manchester continue. I know that my right honourable friend requires further persuasion that some of the actions that appear to be starting to work elsewhere should be put in place. I would gently point him to the fact that we did manage to level off the increase in infections in Bolton when we brought in firmer measures, but they have since then started to go up again when we removed those measures. Nevertheless, he's absolutely right, Mr. Speaker. He's absolutely right that the best way we can tackle this is by people taking personal responsibility for reducing their social interactions, so to reduce the risk of spread. And I hope that we can all metaphorically link arms and get that message across.
Thank you, Mr. Speaker. And small businesses in a Tier 2 area like Newcastle may not be asked to close, but they will face severe reductions in revenue due to local restrictions, affecting football, for example, in the centre of our great city. So he talks about unprecedented support, but these are unprecedented challenges for viable jobs in our city centre. So in addition to what he's already mentioned, what local economic support will he offer to businesses in Newcastle?
Well, if we do need to bring in further measures in Newcastle, then there is absolutely further support that's available, and there's already unprecedented economic support that my right honourable friend the Chancellor has set out.
Bernard Jenkins.
Mr. Speaker, can I tell my right honourable friend that most of the MPs in Essex have reluctantly felt the need to support the Tier 2 measures that are now being applied, but we are very concerned about the effect of this on the hospitality sector in particular. And isn't it so important that we align the economic interests of our constituents with the public health interests instead of polarising the debate that you're either in favour of the economy or in favour of controlling the virus? And can I also just emphasise to him that one of the reasons why that public confidence is in somewhat decline in the government strategy is because we have yet to see the transformation of the leadership of test and trace, about which I have discussed with him many times.
Well, thank you, Mr. Speaker. Where I agree with my right honourable friend is that there is no trade-off between health and economic measures, because if the virus gets out of hand, then we will end up with a worse economic hit as well. And I know that my right honourable friend agrees with that, because we've discussed it many times, and it's one of the reasons that he, like other Essex MPs, may not like the fact that we have to collectively put in place these measures in Essex, but it is the right course of action.
Thank you, Mr. Speaker. As Warrington's neighbouring Liverpool City region and Lancashire are in Tier 3, with Greater Manchester expected to shortly follow if financial support is agreed, we need confidence that if we will be asked to follow suit, that there is robust evidence for the required closure of hospitality businesses, leisure businesses and salons. Will the Secretary of State commit to publishing the specific UK transmission data for these sectors compared to other workplaces, or are they merely a soft target?
Mr. Speaker, we have published further data late last week on exactly the question that she asks. And we have the backward contact tracing in place that the honourable gentleman asked for, and I apologise, I didn't answer his question on that. And we have seen the evidence from that. And the critical thing, though, is for us all to recognise that in places like Warrington and the surrounding area, where the number of cases is going up and the number of cases amongst the over 60s is going up, which is particularly worrying, then we do need to act, and we need to act together if at all possible.
12 withdrawn, so we're going up to Ealing North with James Murray. James Murray.
Thank you, Mr. Speaker. The October 2020 World Economic Outlook, published by the IMF, clearly states that short-term economic costs of lockdowns could be compensated by stronger medium-term growth, possibly leading to positive overall effects on the economy. Now, the government clearly disagrees with the IMF's assessment. So can the Secretary of State tell me whether he or his colleagues have carried out any analysis into the economic impacts of a national circuit break?
Thank you very much, Mr. Speaker. Well, of course, we look at all of the impacts of all of the policies, but we know that the more targeted a policy can be, both in terms of the measures and the geography, then of course the less disruption that it'll have. But if his concern is with a national circuit break, that is not the policy of the government. The policy of the government is to have a localised approach. So you might want to have a word with the front bench opposite.
Andrew Selous.
The Secretary of State quite rightly finished his statement by saying that we must all play our part in getting the virus down. Does he think it was that shared population-wide commitment in Wuhan in China that seemingly seems to have got life back to normal? And what lessons are there from what China has done that we could usefully apply here in the UK?
Well, I would be cautious about some international comparisons, because life isn't exactly back to normal and there are restrictions still in place. For instance, we have seen today Sweden introducing measures, restrictions, on a regional basis, which is similar to the approach that we have here. So there is a lot of debate about international comparisons, and we do look across the board, but I'm not sure it's true to say that life is back to normal in Wuhan. What we need to do is get the science to come to our aid and help us get life back to normal here as quickly as possible.
you, Mr. Speaker. This weekend I spoke to pub landlords, cafe and bar owners and staff across our towns, and they all said that business had plummeted since Wednesday when we became a Tier 2 area. They were all cutting staff hours, some were considering closing completely, and none of them were getting additional support because the Tier 2 job support scheme simply does not work for them. So does he not understand that in order to sustain support for additional health measures, he has to listen to the people who are being most affected by them? Will he look again at support for Tier 2 and Tier 3 and make sure that jobs and businesses get the support they need?
Well, again, Mr. Speaker, I'm going to come to the defence of my right honourable friend, the Chancellor, who has put in these support packages on a scale that's never been seen before, and absolutely, she's right to raise the concerns of those in her constituency. But the combination of all the schemes that are available to businesses is something that of a scale that this country has never had.
How many separate COVID vaccinations are undergoing trials at present in the United Kingdom? And specifically, what is the planned duration of the trial period for each?
There are 3 vaccine trials underway in the UK. The AstraZeneca trial, which is well discussed and frequently discussed. Also the Imperial College trial and a trial of the Novavax vaccine. The period of the trial is dependent on the clinical results and on the data. Of course, the AstraZeneca trial of those 3 is the most advanced and is in phase 3 trials, and we're closely in contact with all of them to ensure that they get the support that they need.
Mr. Speaker, I was alarmed, as were many public health experts, to read reports over the weekend that test and trace data is being shared with the police. And even a source in the Secretary of State's own department said that this will put people off getting tested, which I hope he will agree with me is the exact opposite of what we need. Public trust and confidence in test and trace is critical, and transparency of the use of personal data is central to that. So will the Secretary of State therefore publish today the Memorandum of Understanding that he and his department has signed with the National Police Chiefs Council?
Well, Mr. Speaker, it is very important that people come forward for testing. As the Chancellor of the Duchy of Lancaster said yesterday, of course, the vast majority of people not only come forward for a test and want to come forward for a test when they have symptoms, but also want the isolation arrangements to be enforced fairly, so that everybody everybody isolates when they need to. That's the reason that we've taken the approach that we have, that I set out to the House several weeks ago.
James Daly.
Thank you very much, Mr. Speaker. Since the beginning of the pandemic, there has been no recorded outbreak of within public house in my constituency of a COVID-19 outbreak. Because of taking into account low national rates regarding transmission from pubs, can I ask my right honourable friend to consider, when in negotiations with colleagues from Greater Manchester, to think very carefully before closing these COVID-secure environments who've spent thousands to ensure they are secure, or to cease from putting on extra restrictions which will make trading an impossibility?
Well, Mr. Speaker, nobody has stood up for the pubs and hospitality businesses in Bury more than my honourable friend. And he makes an important argument about the outbreaks. We also have to look at the backward contact tracing data, and we have to look at where measures to bring the virus under control have worked. So I'll very happily have a further discussion with him to try to make sure that we can get the right set of measures and bring the right balance.
Jim Shannon.
Can I thank the Secretary of State for his regular attendance in the Chamber and for his response to the questions as well. Will the Secretary of State outline the procedures and criteria for the vaccination schedule, bearing in mind that news reports cite availability of the fully tested vaccine to be in the near future? And does the Secretary of State agree that frontline workers in shops need to be part of the list of recipients on the priority list after the medically vulnerable, the NHS and the caring profession staff.
Seriously.
Well, thank you very much, Mr. Speaker. Of course, no vaccine technology is certain, but the longer we go without bad news, the better things are, because we would hear if things had not gone well, and so things are therefore progressing. The Joint Committee on Vaccinations and Immunisations produces a prioritisation based on clinical advice and their clinical judgment in terms of who ought to get the vaccine in what order. I think this is a really important question to make sure that as we roll out the vaccine, we do so fairly and on an agreed basis. I'll ask them to look at his specific requests to make sure that's taken into account, and their advice is very important for the government decision that I hope the whole country can then get behind.
John Howell.
Thank you, Mr. Speaker. I make no apology for again bringing up the question of cotrimoxazole, since I believe the drug can help very much in the fight against COVID. And I wonder whether the Secretary of State could tell me, following the successful trials that have taken place in India and Bangladesh, whether there has been any progress here.
I will. He's right to raise the question, and I will write to him with a full update once I've taken advice from my clinical advisors and from Professor Jonathan Van Tam, who leads on this area.
Evan Jones.
Thank you. At the weekend, Mrs. Helen Perry, one of my constituents, contacted me to tell me that her son and 3 of his flatmates at Northumbria University had tested positive for COVID. They're all self-isolating. Despite that, they're being bombarded up to 10 times a day from NHS Test and Trace. It's the same story for Mr. Brian Sayers and his family, who are self-isolated because a member has tested positive. In Brian's words, we're not stupid people. We don't need pointless telephone calls every other day. What a waste of time and money, says Mrs. Perry. Can I ask the Secretary of State when he will admit the national system has failed? And when will he hand over test and, more importantly, tracing to local directors of public health who know their areas and know their communities and know how to do test and trace properly?
Mr. Speaker, the honourable gentleman is completely wrong on 2 fronts. This has been a very consensual statement so far, Mr. Speaker, and the honourable gentleman has played a positive part in the right honourable gentleman has played a constructive part in getting the public health messages across in Northumberland. But he's wrong on 2 fronts. The first point that he's got wrong is that when Test and Trace contacts people to remind them to self-isolate, that is based on the analysis we've done of what helps to ensure that people stay self-isolating. Yes, repeatedly, absolutely, I make no bones about it. Yes, because the isolation of people so that they stay isolated is important. So, he can complain that we're doing too much, but that's not normally the complaint I get from the opposite side. And then the second point is that this must be, in his words, handed over to local authorities. No. It's got to be teamwork with local authorities. It's teamwork that'll help us get through this, not this attempt to separate out people and say one side's good, one side's bad. We're all on the same side in this fight against the virus.
William Wright.
Thank you, Mr. Speaker. And further to this consensual statement, we're all keen to be guided by the science, and so I wonder what scientific behavioural assessment has been made of the effects of closing COVID-secure venues on the likelihood of people to meet in one another's homes instead, thus spreading the illness further. Now, if my right honourable friend hasn't got the information immediately to hand, perhaps he'd care to write to me, as is the fashion.
No, I can answer the question. Because my honourable friend makes an important point, and what I'd say is that the evidence that we have, indirect evidence of hospital admissions due to people over-inebriated, has reduced since we brought these measures in, and that is one indication that people are generally following the rules and at 10 o'clock as I did, going home to make sure and following the rules, which the vast majority of people are doing.
Can you tell the Mail on Sunday then? Tony Anthony, I'll say.
Thank you, Mr Speaker. And as the chair of the APPG on Cancer, I'd like to thank the Secretary of State for a recent meeting regarding the Catch Up with Cancer campaign. I too pay tribute to those delivering frontline cancer services throughout the pandemic. But the 63% that he has mentioned does not reflect the totality of the backlog. The NHS have announced new figures since then, and in August, the number of people waiting over 52 weeks in England has continued to surge to over 110,000, the most in 12 years. The only way this backlog goes away, Secretary of State, is with action and resources deployed to tackle it. So what progress has the Secretary of State made to address the need for a boost for cancer services so that cancer doesn't become the forgotten sea? Thank you.
Madam Deputy Speaker, the Honourable Lady is absolutely right to raise this. In my statement, I said that those long waiters waiting over 104 days, the longest of waiters, that has fallen, that we've managed to reduce that backlog by 63%. We've managed to reduce the backlog amongst those waiting more than 62 days by 44%. So there is further work to do, of course there is, but the NHS has made very significant strides in the backlog of people waiting for cancer treatment, and I pay tribute to all the work that they've done.
Greg Clark.
Thank you very much indeed, Madam Deputy Speaker. Madam Deputy Speaker, the concern that many of us have is that restrictions can be imposed in a day, but then take months to lift. And we know that in London, the restrictions were imposed not because of a high level of infections or a high level of admissions to hospital or deaths, but because of a rapidly increasing rate of infection. If it turns out next week when the Secretary of State conducts his fortnightly review, that actually the rate of increase of infection is no greater in London than it is in places at a lower tier, will he rescind those restrictions and return it to the lower tier?
Secretary of State.
My right honourable friend makes asks a very important point, and in a way highlights that it isn't just the case rate that matters, it's also the rate of change of the case rate and the over 60s case rate and the impact on hospitals. In the case of London, cases are over 100 per 100,000, which is a worrying level, but I really hope that the measures and the people of London and all those who work here can bring the case rate down, and then we can get out of it as fast as possible. Team London are in fact working on a proposed strategy for coming out of level 2, but the first thing that everybody in London has to do is follow the rules to get the rate of increase down, because it's only then that we can even start to consider what the next steps are.
Liz Twist.
Thank you, Madam Deputy Speaker. Earlier this year, at the start of the pandemic, the Government committed to give the NHS whatever resources it needed to deal with coronavirus. The NHS has that money for dealing with Covid-19, but it will need more to enable it to catch up on all of those conditions which need to be treated now that treatment is taking place. Will the Secretary of State now commit to provide the funding and resources needed to carry out these vital treatments?
Secretary of State.
Well, we have put that extra resource in that she mentions, and that's important. It's not only that the extra resource has gone in, but we're also hiring the people to do the work and building the buildings in which it can be done. So she raises a very important point about the need to recover all of the work, all of the backlog. I'm really glad that in areas like cancer and many other areas that backlog is being worked through, but there's still more work to do.
Chris Grayling.
Thank you, Madam Deputy Speaker. Can I support my right honourable friend's targeted approach? It is absolutely wrong, in my view, to close businesses and lock people in their homes on a broad brush area across areas where the risks are much lower than in others. He's following the right strategy. But can I echo the comments of my right honourable friend for Tunbridge Wells about London? There are many of my constituents who have businesses across the border in South West London where it is not the case that the rate is over 100. There are large swathes of South West London where it is well below 100. So please can you make sure that it is possible, as quickly as possible, to disaggregate those areas of London where the problems are less and to move back to a situation where those businesses can operate normally?
Well, as our friend, the member for Wimbledon, who was sitting over there, no longer, said at the start of this statement, it is important to take a borough-by-borough approach, and I commit to doing that. Unfortunately, there are parts of South West London, like Richmond, which do have an elevated case rate above 100. But in London, this work has been done effectively across party lines, working with the leaders of the local councils, the boroughs, as well as with the mayor. But I'll take into account the point that my right honourable friend makes.
We now go to Barbara Keeley.
Thank you, Madam Deputy Speaker. A number of families in my constituency are worried about the impact that isolation is having on their family members with dementia living in care homes with no visits allowed. In one case, a constituent's mother phones her daily and threatens to take her own life because of the lack of contact with her family. Now, the Care Minister told the Select Committee last week there would be a pilot of visiting in care homes, but that may be months away. And now the Secretary of State talks today about visits when restrictions are reduced. But this situation is desperate for some families. So, can he tell us when we can have regular, meaningful visiting for every care home resident?
Thank you very much, Madam Deputy Speaker. The Honourable Lady raises a point that is so heartrending and important, as is the protection of care home residents from this disease. The situation is not quite as she said. The situation is that we have different restrictions in different areas according to local circumstances, and with a great deal of delegated authority to the local Director of Public Health to make judgments on this extraordinarily difficult balance between allowing visitors for exactly the sorts of reasons she set out, and between that and protecting people who live in care homes from catching the disease. Because when the number of cases when the case rate is high in the community, then naturally that increases the risk in care homes, not just because of visitors, but also because, of course, the staff who work in care homes live in the community. The best thing we can do, and I'm sure that she'll agree with me on this, the best thing that we can do is keep the prevalence of coronavirus down, and that way we help protect people in care homes as well.
Mark Horsey.
Thank you, Madam Deputy Speaker. This time last week, the whole House, I think, welcomed the introduction by the Prime Minister of 3 COVID alert levels to provide some certainty about levels at which measures would be introduced and what measures would apply in a given area. Rugby is currently on a downward trajectory with less than 100 cases per 100,000. So I wonder, can he reassure my constituents that by sticking to the rules, we will continue to remain in Tier 1?
Yes, I think, Madam Deputy Speaker, we can put it like this, that one of the advantages of the tier system is not only that there is a clear and clearly set out set of actions that are needed to be taken if the cases go up, as in London last week, but also to help to motivate people who are in level 1 areas that to stay in level 1, the best thing to do is to follow the rules and to respect social distancing and to play your part in the reduction of the spread of the virus. Because everybody who is living in any level 1 area can help do their bit to stay in level 1 by following the rules, face and space, and following social distancing. And my honourable friend is absolutely right to point that out for rugby, but the point applies right across the whole of England covered by level 1.
We now go to Stephen Bonnar.
Thank you, Madam Deputy Speaker. Given the national minimum wage already falls far below the real living wage, does the Minister think people will be able to survive this winter with their workplace closed and now only receiving 2/3 of that amount? And will the Government not give consideration to the calls from the Scottish Government and English regional leaders? Do the right thing and offer more assistance.
Well, I'm really proud to be to have been part of the government that introduced the national living wage and to increase that level of support for the lowest paid right across the whole United Kingdom. That's one example of the UK government working to improve the support available and the pay for the lowest paid people both in Scotland and across the whole of the rest of the United Kingdom, alongside the unprecedented economic support that my right honourable friend, the Chancellor, has put in during this crisis.
Sir Geoffrey Clifton-Brown.
Thank you, Madam Deputy Speaker. May I wholly applaud my right honourable friend's approach to localised lockdowns, but I wonder whether he would agree with me that in an area like Gloucestershire, where mercifully the number of cases is still relatively low, the track and tracing and advice on self-isolating could be improved further by involving both national and local resources.
Secretary of State.
Yes.
Derek Twigg.
Thank you, Madam Deputy Speaker. Secretary of State last Tuesday, at that dispatch box, said we are now acting to simplify and standardise the rules at local level. He said that in support of the new three-tier system. At that point, Liverpool it was put into tier 3 system, and the gyms would close in Merseyside and Halton. But by Friday, when Lancashire went into tier 3, they were allowed to keep their gyms open. So my question to the Secretary of State, why is that difference there? And can I say to him that he should straight away authorise the reopening of gyms in Merseyside and Halton? There is no evidence to keep them closed.
Secretary of State.
Well, Madam Deputy Speaker, that decision was taken in consultation and agreement with the local area, part of the work to work with local areas on this has been to agree the exact details of the package in level 3.
We now go to Dame Cheryl Gillan.
At the moment, the only defence against the virus is modifying people's behaviour, and cases of COVID are rising in Buckinghamshire, and we want to stay in Tier 1. So our NHS Trust and Council have taken the initiative and filmed a strong local public health message, which is now on YouTube and social media, recorded by Dr. Tina Kenny, our medical director, and asking people locally to follow the rules to reduce the spread of this highly contagious virus. Would he commend this communication from our local health trust and council and encourage other health authorities and clinicians who people trust and have confidence in to engage directly with their populations to send these vital messages out?
Secretary of State.
Yes, I applaud the work that's been done across Bucks to deliver public health messages and to try to get the whole community to support the action that we all can play our part in, and that my right honourable friend quite rightly raises.
We now go to Bill Esterson.
The Health Secretary really should admit that Serco has failed. £12 billion for Serco would mean £300 million for the Liverpool City region alone if it was shared fairly across the country. So when is he going to give these levels of funding to local public health teams? And when will he instruct Dido Harding to give local teams the data that's currently held by Serco so local teams can do the job that Serco has failed to do?
Secretary of State.
Well, given that over the weekend we hit 300,000 tests a day for the first time, you would have thought that the honourable gentleman might have looked at the data and looked at the improvements that's happening. And they say not testing. Well, they used to complain about testing, didn't they? And now that's going well. And contact tracing is getting better. And last week, contact tracing in this country contacted more than double the number of people than the week before. So I think that instead of having a go at all the people who are helping to solve this massive problem, that side of the House should get in support of them.
Robbie Moore.
Thank you, Madam Deputy Speaker. It has been demonstrated that far ultraviolet C light emitted by krypton chlorine lamps inactivates COVID-19 on surfaces, as well as when coronavirus is airborne. Some fantastic research is currently being undertaken to look at this, notably by St Andrews University in Fife, Ninewells Hospital in Dundee, but also a business in my constituency of Keighley. As a potentially game-changing mechanism for inactivating the virus, could my right honourable friend outline how this has been explored at a government level?
Secretary of State.
Yes, I have seen this research, and I'd be very happy to meet my honourable friend to discuss how it might be applied.
Then I go to Liz Saville-Roberts.
Diolch i'r Wales is to go into lockdown on Friday.
Scotland, Northern Ireland and regions of North England are already in similar measures. Fire break restrictions in Wales are tailor-made for the health needs of Wales, but the Treasury's support schemes are based on political considerations and what best serves the south of England. Will he commit to bringing forward the job support scheme by 8 days, only 8 days, and to increasing the level of support to that of the first furlough scheme so that more people in Wales can afford to stay safe?
Secretary of State.
Yes, Madam Deputy Speaker. Well, of course, the furlough scheme continues until the end of the month, and the job support scheme replaces it. So that's the reason for the timings. But what I'd say to her, the premise of her question, is that the job support scheme, like the furlough scheme, supports every single part of these United Isles. It supports the whole UK, including Wales. It is the UK government coming to the aid of every single person in difficult times. And I think that is the approach that we should be taking, supporting everyone wherever they live in this great country.
I go to Peter Bone.
Thank you, Madam Deputy Speaker, and I would thank the Secretary of State for yet again coming to the House and updating the situation. I'd also like to, well, I think the whole House would like to congratulate the Secretary of State on getting on target to get 500,000 tests per day. That is quite remarkable. But some scientists are saying that 1% of those tests are false positives. In other words, 5,000 a day won't actually have the disease. So up to a quarter of the people each day who we report of having COVID-19 might not. Has the Secretary of State got any suggestions how that might be improved?
Yes, Madam Deputy Speaker, it's an important question that my right honourable friend asks. And the first thing to say is that on the current technology, the PCR test, the false positivity rate is much, much lower than that. The ONS has published its analysis of the impact of the false positivity rate and thinks that the impact of that rate is small. And also the new generation of technologies, one of the exciting things about them is that their false positivity rate is yet lower and so further reduces the problem that my right honourable friend sets out.
Julie Elliott.
Thank you, Madam Deputy Speaker. The Secretary of State has had a good relationship with local authorities in the North East and Sunderland, where I represent. But once again, the request for funding for test and trace and for financial support has still not been answered. He committed to me last week that he would get an answer. The Prime Minister committed to me that he would get an answer, and it still hasn't happened. In the meantime, people are nervous and businesses are on the brink of going under in the North East. It is a very, very worrying time. Can the Secretary of State please talk to local authorities in Tier 2 about the support that is needed on the ground to help communities and businesses survive this terrible crisis?
Secretary of State.
Well, my right honourable friend, the Community Secretary, is having exactly the discussions that are needed to respond to the circumstances, for instance, in the North East. She'll understand that it is for him to discuss council finances with the councils rather than for me. We are putting in the extra support for test and trace and linking up the data systems within the North East. And I'll again leap to the aid of my right honourable friend, the Chancellor, about the extent of support that he's been putting in to areas that are affected particularly by this virus and the level 2 and level 3 restrictions we're having to put in, as he has right across the country.
Simon Fell.
Thank you, Madam Deputy Speaker. Last week, the Borough of Barrow in my constituency went into the high tier, and I'd like to thank my right honourable friend and his team for the work they've done in engaging with local leaders on this. But South Lakeland in my constituency remains in the medium tier, and constituents and businesses from towns like Ulverston are concerned that people are travelling from one tier to the other and not sticking to the guidance and the rules. So what advice would my right honourable friend give on the importance of sticking to those rules in order to turn the tide on the virus for all of us?
Secretary of State.
My honourable friend from Barrow and Furness makes an incredibly important point, that everybody needs to follow these rules to give Barrow the best chance of coming out of level 2 restrictions. And if you live in a level 2 area, then those rules apply to you even if you travel to a level 1 area. If you live in a level 1 area and travel to a level 2 area, then when you're there, the level 2 restrictions apply. I hope that's very simple for everybody to follow, but he has provided great leadership in Barrow in describing so clearly why it's important for everybody to follow the rules, because if we do, then we can get this virus under control and we can get Barrow back into level 1, where I'm sure everybody who lives in Barrow will want to see it.
Florence Echelon.
Thank you, Madam Deputy Speaker. I've heard the Secretary of State talk about the fact that he welcomes the Chancellor's support and he refers members to that. But does he really understand the impact on the ground, especially small businesses? So my constituent in Clapham, he's a supplier to the hospitality sector, and over 50% of his business is with pubs, restaurants and hotels. If there's a further turn down in this Tier 2, he says he won't be able to stay afloat. The government must listen to these small businesses and understand the real-world impact it's having. So will the Minister please ask the Chancellor what additional provisions the government is going to put in place right now to help the hospitality sector?
Secretary of State.
Thank you very much. Well, of course, I'll speak to my right honourable friend, the Chancellor, about that. Coming from a small business background, as I do, I fully understand the challenges and the cash flow challenges that people face. Of course I do. But nobody wants to have these restrictions in place a moment longer than they need. And if she has the concern which she understandably raises, then maybe she can help to explain why this localised approach of having only the restrictions that are needed for that area in place is the right one.
Anthony Higginbottom.
Thank you, Madam Deputy Speaker. Burnley has had additional restrictions in place for longer than most other areas and is now in Tier 3, the very high level. Whilst that's really difficult for residents and really difficult for businesses, everyone wants to do the right thing to bring the infection rate down. But to do that, we need a sense of optimism and light at the end of the tunnel. So could the Secretary of State outline what the exit strategy is from Tier 3 into Tier 2 and then into Tier 1, and also offer some reassurance that once the rate is down, we've got a way of containing it so we don't move back up?
Yes. Madam Deputy Speaker, my honourable friend has spoken for Burnley with such passion throughout this crisis. It's been very difficult for Burnley, and now Burnley has seen the highest case rate amongst the over 60s in the whole country, and it's so important to protect people in Burnley that everybody follows the rules there. The first thing I can say to him is that we've got to get the case rate falling, and we've got to get the cases amongst the over 60s falling, and once that starts to happen, we can talk about when we can start to relax the restrictions. I don't want to have them in place a moment longer than necessary. And then, with the expansion of testing that we're seeing, I hope that we can have more tools at our disposal to hold the virus down once we've got it down again.
Caroline Lucas.
Thank you, Madam Deputy Speaker. Rebuilding confidence in test and trace is critical, yet the Secretary of State has taken the potentially counterproductive step of arranging for data to be shared with the police for enforcement, which could deter people from getting a test in the first place, as the Chief Medical Officer has himself reportedly indicated. So will the Secretary of State acknowledge that a more effective strategy would be, first of all, to ensure that people have the financial security they need in order to be able to follow the rules in the first place? And following the question from the Honourable Member for Twickenham, will he answer whether or not this Memorandum of Understanding exists? If it does, will he publish it? And if he won't, will he explain what he's hiding?
Secretary of State.
Madam Deputy Speaker, there is no health data that's transferred, but of course, once this House has voted for an enforceable rule, then it is important for all of our constituents and communities that we enforce it. And so that is a necessary consequence of the House having voted for the self-isolation rules to be made mandatory, which I think was the right decision. And when it comes to the financial support that she asked for, we have put in place £500 per self-isolation to support people on low incomes to make sure that they're able to do the right thing.
42 withdrawn, so Rachel Maskell.
Thank you, Madam Deputy Speaker. To prevent further restrictions being placed on York, we have to lock down this virus, not lock down people and the economy. Now, we know the key to this is local contact tracing. And the reality is the shadow contact tracing undertaken by my local authority has been more accurate, more effective, more responsive, and that is the key to getting on top of this virus. So when will the Secretary of State release all the data to local authorities and give them the resources they need so they can do the job properly and get on top of this virus?
Yes, we are absolutely putting more resources into contact tracing in York, and it's only because of the combined effort of the national and the local team that we're able to do the work that she describes, because the national system can deal with the cases who are easy to get in contact with or who prefer to do contact tracing over the internet rather than on the phone, which is a lot of people. And that means that the local authority, as is in the case that she describes, can do their work locally. So it's about having a team effort.
44 withdrawn, so we go to Richard Bergen.
Thank you, Madam Deputy Speaker. People will have seen images of packed rugby stadiums in New Zealand last week after the country announced it had effectively ended domestic transmissions of coronavirus. They followed a zero COVID strategy and have had a tiny number of cases over the recent period. As we face another wave of unnecessary deaths here, life is returning to normal there. So is the Secretary of State embarrassed that other countries have managed to drive down the cases whilst his government is failing?
Secretary of State.
Madam Deputy Speaker, we're doing everything we possibly can to suppress this virus. There have been some countries, there have been some parts of this country that have explicitly followed an eradication strategy. Unfortunately, there isn't anywhere where that has worked permanently, and we have seen flare-ups in all parts of the world that have pursued an eradication strategy. The critical thing here is to suppress the virus, to get it under control, and to keep it under control, and for everybody to play their part.
Mary Robinson.
Thank you, Madam Deputy Speaker. A further week has passed without agreement with Greater Manchester. However, Stockport Council has set up a pandemic response team working in the community, promoting COVID-safe behaviour at pubs, bars, businesses and hairdressers, etc. Last week they visited over hundreds of businesses and found very good COVID compliance. As the Secretary of State works to reach an agreement in Greater Manchester, and I wish him the best of luck with that, and I hope that goes well, would he also consider in a borough-by-borough approach and take into account the work done by local authorities with all the leisure industry to try to get those transmission rates down?
Well, I know that many of the local authorities in Greater Manchester, in fact all of the local authorities, have taken very seriously their statutory responsibilities to get the virus down. And I pay tribute to my honourable friend who has been assiduous in her work to support her local community to do the right thing. I just hope now we can come to an agreement with the GM leadership in the same way that we've come to an agreement with the Liverpool leadership and the Lancashire leadership, and we're working with the West Yorkshire leadership across the different boroughs there, and with the South Yorkshire leadership, and with the leadership in the North East, and with the leadership in Teesside in a highly constructive way, and I hope that we can do the same with Greater Manchester.
Alex Shelbrook.
Thank you, Madam Deputy Speaker. My right honourable friend has heard across the chamber the real challenges that the hospitality industry is facing, especially in Tier 2. And further to my honourable friend from Keithley's comment about emerging technology in air sanitisation, especially using UV, could I ask my right honourable friend to actually go further than he's promised to my honourable friend for Keithley and actually get a round table together as quickly as possible so that we can work together, bring this technology forward. I've got constituents who are ready to bring this forward, so we may be able to get this into the hospitality sector more quickly and hopefully give them some relief.
Secretary of State.
Madam Deputy Speaker, nobody has done more to support the pubs of Leeds than my honourable friend, and he's doing it again today. So let's turn the meeting into a round table. I'll make sure that that happens in the next fortnight, and we will we'll do all the work to bring this new technology to bear.
Alison McGovern.
Thank you, Madam Deputy Speaker. Can I return the Secretary of State to care homes? He knows the utter dilemma that care homes their residents, the staff and all of their families face between allowing the infection into the home and causing such damage to the welfare of residents by not allowing visitors. And he said earlier in response to my honourable friend that he was empowering directors of public health, which in some ways is welcome, but it needs a much more well thought through plan than that. And I do think the Department for Health ought to be offering much more policy support. The opposition has worked hard on a plan for care homes. So will the Secretary of State say what his department is proactively doing?
Secretary of State.
Yes, and I think the Honourable Lady puts it very appropriately with this, the sensitivity of this dilemma. We have published a winter plan for care homes which sets out our approach in this area and are working on the implementation of that plan. And I'd be very happy for the Minister for Care, who leads on this, to meet with her to discuss how we can make sure that that's best done most effectively in her area.
Jason McCartney.
Thank you, Madam Deputy Speaker. Having been out in my Colne Valley constituency this weekend, it's clear that local people do want the tier system to work, but that does mean we need more financial support for Tier 3 and Tier 2, especially hospitality, where custom is really down. And will the Secretary of State also lay out a clear framework for timescales and how areas move within tiers so that businesses and communities in West Yorkshire can plan ahead?
Secretary of State.
Well, I would love to be able to give time frames, but unfortunately one of the things about this disease is that it moves fast, and sometimes we have to move fast too. So I think it's better to say that I'll always keep this under review. Of course, the critical thing is, once this House has voted for an area to go into Tier 3, there will be an automatic review of that legislation after 28 days, and it will need to be proposed again. It's sunsetted after 28 days, which means that people can have confidence that it will be reviewed. But of course, if we can review it quicker than that, then absolutely we will. I take his point on the financial support, and again, I'll discuss it with the Chancellor.
Ben Bradshaw.
Why is the government still forcing people arriving in this country from countries with far lower COVID rates than us into a compulsory 14-day quarantine when it is absolutely crucifying the travel industry, and they're far more likely to be infected here than they are in the countries they're arriving from?
Secretary of State.
Well, we of course keep the countries that are on the quarantine list under review. Absolutely we do, and that is a weekly exercise that's led by my right honourable friend, the Transport Secretary.
Dr Andrew Morrison.
There's now compelling evidence to suggest that vitamin D may be useful in reducing mortality and morbidity from vitamin D. It's safe, it's cheap, and it's already recommended by his department for certain groups. Given our need to tackle this disease, and given that vitamin D requires 3 months for it to build up sufficiently to protect against respiratory infections, what advice will the Secretary of State give urgently on the use of this particular intervention?
Yes, well, we are increasing the communications to people about the benefits of vitamin D, and as I said to the House on Thursday last week, we're also instituting further research into the points that he, as an experienced and qualified medical professional, sets out so clearly.
Angela Eagle.
Thank you very much, Madam Deputy Speaker. Secretary of State, I'm sure you'll agree with me that to be effective, rules have to be understandable and simple. So why in Merseyside, which is currently in Tier 3, were all the gyms forced to close, but soft play was left open? And in Lancashire, all the gyms were left open and soft play was closed. Surely this doesn't make any sense at all. And will he publish the evidence that he's got and be consistent across tiers? Either all the gyms are open or they should all close. Which is it to be?
Well, the baseline for Tier 3 is set across the board, and then further measures are set out in consultation with an agreement with the local area.
Damien?
Thank you, Madam Deputy Speaker. Following on from that, the gyms in Lancashire are open, the gyms in Merseyside are closed. The deal that was struck for us wasn't a good deal for my constituency in Southport. Will the Secretary of State review these restrictions as soon as possible and get our gyms open? They are part of the solution, not part of the problem.
Secretary of State.
Well, nobody has stood up for the gyms of this country more than my honourable friend, and he's made this argument endlessly. He's made this argument endlessly to me, and he stands up for Southport. And I will take this point away, but as I said to the honourable lady opposite, the reason that these decisions were taken was in agreement with the local area, and we want to, as much as possible, make agreements with local areas so that we can all give over the same public health messages, which is if everybody follows the rules, then we are more likely to get this under control and get the Liverpool City region out of Tier 3 altogether.
Maria Eagle.
Thank you, Madam Deputy Speaker. Can I thank the Secretary of State for his kind words about Bill Anderson, the brother of the Mayor of Liverpool, who sadly died of COVID and was my constituent. He was a doughty campaigner for seafarers, for their livelihoods and welfare, and he'll be very sadly missed by many of us. In Liverpool, the government's test and trace system is only reaching 59% of contacts, in Knowsley 57%, both well below the 8% target. And the percentage of contacts reached has fallen over the last month by 3.5% in Liverpool and 9% in Knowsley, just as both areas have been placed in the very high Tier 3 restrictions. So why is it so low? Why is it declining? And what is the Secretary of State going to do to improve this performance? Because we really need it to be better.
Well, the proportion of contacts that are reached that are in settings that are called complex settings in the system, for instance care homes, where it's relatively easy to find all of the contacts by the nature of the setting, the proportion of contacts in those sorts of settings has itself fallen as the number of cases has risen. And if you look at the effectiveness of the system as a whole, both national and local, at reaching people in the community, that has been broadly flat, as has the proportion reached in those complex settings where it's much easier, and often the proportion is close to 100%. The challenge has been that as the community, the number of contacts in the community has risen, so the overall proportion of those who are harder by their nature for the contact tracing system to reach has gone up. That's the direct explanation for the figures that she describes. The best solution to this problem is the combination of the national and local system working together, and we're putting in place closer connection and extra financial support, both in Liverpool and in Knowsley, as she sets out.
Mr. Carney.
Thank you, Madam Deputy Speaker. I commend my right honourable friend for overseeing 300,000 tests a day across the country. And can I ask for two things for my constituents in Wilden? Can the Minister thank the care workers that do such tremendous work in the care homes in Wilden? The Minister will know our concerns about winter flu coming to care homes as well. I had a long meeting with a number of care home providers across the constituency. They're incredibly pleased with the access to testing, but just one care home in Uckfield complained that 25% of tests weren't picked up by courier, just one. And I know my right honourable friend will want to nip that in the bud immediately.
Secretary of State.
Well, throughout this, and even with the challenges on, with demand for testing that we saw last month, we've kept the tests going to care homes because people who live in care homes are the most vulnerable. And no matter what we do to protect care homes from coronavirus, the higher the number of cases in the community, the more likely it is that staff who live in the community, and of course visitors where their visiting is allowed, there is more likelihood of a case getting into a care home. It is a sad fact of life. We do everything we possibly can to prevent that, including the brilliant care staff who work in her constituency, to whom I pay tribute. And on the particular point about a courier being late for a pickup, I will look into that immediately and see if we can resolve that.
Mick Whitley.
Thank you, Madam Deputy Speaker. On a whittle, over a third of the people who have been in contact with someone with COVID-19 have not been contacted by test and trace
Will the Secretary of State concede that the outsourcing of testing straight is simply not working and that his responsibilities should now be given to the local public health teams?
No, I think it should be a team effort.
Scott Benton.
Thank you, Madam Deputy Speaker. Whilst many of my constituents recognise that the decision to place Lancashire into Tier 3 was indeed justified on public health grounds, this will nevertheless leave many of them and those who own businesses significantly worse off as a consequence. There has to be a clear pathway out of Tier 3 for those local authorities who currently have these restrictions. And so will my right honourable friend clarify the basis on which the continuation of these restrictions will be reviewed and how often this will take place?
Secretary of State.
Well, Madam Deputy Speaker, we will formally review the restrictions that are in place in Blackpool alongside the rest of Lancashire every 28 days, but that is as a maximum, because if we manage to get the cases coming down before then we will take areas out of level 3 restrictions. The goal for everybody in Blackpool should be to do their bit, play their part, follow the rules, and let's try to get the number of cases down, and then we can restore some of our freedoms and also, of course, support businesses who are understandably struggling across Blackpool.
We now go to Christian Matheson.
Thank you, Madam Deputy Speaker. And can I echo the words of my honourable friend from Garston and Halewood and thank the Secretary of State for his tribute to my dear friend Bill Anderson, who will be a great loss to my whole region and to the maritime community. Madam Deputy Speaker, the specific geography of Chester means that many of our businesses, which were viable only until a couple of weeks ago, are now being damaged by, on the one side, restrictions on the other side of the Welsh border, which runs through Chester, of course, and the lockdown there, and on the other side by the imposition of Tier 3 in Merseyside. Chester is being crushed from both sides, but both of these areas are getting heavily supported financially, whereas that support is not available for businesses in the middle, in Chester. Will the Minister consider these effects, and will he provide financial support so that we don't get crushed between these lockdowns?
Secretary of State.
Of course, I understand the point that the honourable gentleman's making, and I know Chester well. In fact, it has more pubs per head of population than any other city in the country, and therefore the hospitality industry in Chester is incredibly important. We are giving as much support as we possibly can, but we always keep these things under review, and I look forward to working with my honourable friend to support the people of Chester.
Holly Mumby-Croft.
Thank you, Madam Deputy Speaker. Can I thank my right honourable friend for his work? Can he give me an update on the availability of the Roche reagent that we've seen a shortage of in Scunthorpe? Can he A, reassure me that those who need an urgent blood test can get one, and B, that the lack of reagent won't affect COVID tests? Thank you.
Yes, I can. I hope I can reassure my honourable friend on both points. We have largely resolved the problem of the supply of Roche kit for non-COVID tests, mostly blood tests. And there's been a huge amount of work, and I want to thank my team and the Roche team for solving this problem with this, the warehouse in Kent. And secondly, I can absolutely reassure her that this does not affect COVID tests. It was although Roche do supply about 5,000 COVID tests a day, they were able to be protected throughout this.
Cat Smith. Deputy Speaker. At the beginning of last week, my constituents in Lancashire were already bound by local restrictions. Last week, the Secretary of State made very clear that Lancashire was being put into a Tier 2 restrictions. That actually was a relaxing of the restrictions that my constituents had at the beginning of the week. By Friday, my constituents were told that we were going into Tier 3. This hokey-cokey of restrictions has left my constituents who want to play by the rules really confused as to what the rules are, even though they want to abide by them. And I level with the Secretary of State that the communications that come from his department need to be clearer. But I'd like to ask the Secretary of State about support for businesses, because we have businesses that are viable businesses in Lancashire, and they're now knocking on the doors of our district councils asking for financial support. But those district councils have not been told what criteria they'll be able to distribute that support, and they've not had the cash released from government.
When will the Secretary of State get a grip on this situation? Secretary of State.
Well, I will defend the honour of my right honourable friend, the Chancellor, who has put in huge amounts of economic support. On the first point, of course, one of the reasons to go to the tier system, and one of the reasons I think it was at the time widely welcomed across the House, was in order to have a system that people can much more straightforwardly understand about what the rules are. And what I'd say to everybody living right across Lancashire is that the very high alert level in Lancashire is because we urgently need to get the case rate down, and the thing everybody should do is follow the rules and the restrictions that are in place. They are there for good reason. They're agreed right across Lancashire, and I think what we can all best do together is work together to get those rates down.
Last question, Catherine Fletcher.
Madam Deputy Speaker, I thank my right honourable friend for his statements and for recent private meetings. People of Lancashire and the good people of South Ribble get that this is all about saving lives, full stop. But they are weary of restrictions that have been going on for weeks, and they are worried about their jobs. So can he assure me and them that we will only be in these restrictions of Tier 3 as long as it is to save lives?
Secretary of State.
The Tier 3 restrictions are put in place when the local NHS is at risk of being overwhelmed, and we will not keep people in restrictions for one moment longer than we need to. Nobody wants to have these restrictions in place. They're there for a reason, and the reason is clearly set out, as she said, which is to save lives with the minimum negative impact, protecting the economy and education and supporting the NHS as much as is possible. That's the strategy. I think it has very widespread support, both in this House and amongst the public. And the measures that we put in place in order to deliver it are put in place with the deepest reluctance. But the single best thing, Madam Deputy Speaker, that you or my honourable friend or anybody can do in this country is to abide by the rules, be cautious about social interaction, hands, face and space, and that way we can all help to restrict the spread of this virus, get it under control, whilst we support our scientists to come forward with the innovations that eventually will get us out of all this.
Order, 3-minute suspension to allow safe exit and entry.